Natasha Roper, Practice Supervisor at NGPG Family Medicine located here in Medical Park 2. Here at our clinic, we have 36 family medicine residents and 12 family medicine faculty, plus 2 family medicine obstetricians and a midwife. We also have a pediatrician and a pediatric nurse practitioner, as well as 2 pharmacists and a behavioral health specialist. Our family medicine clinic is comprised of 29 patient exam rooms, as well as an NST monitoring room, an ultrasound room, an OMT room, and we also have 2 small procedure rooms for non-invasive procedures. We have 4 resident workstations to provide a comfortable space for our residents to do chart documentation. We house a moderately complex lab, which allows for on-site processing for certain labs, creating a faster turnaround time for results.
So Quest for Excellence is our program that looks at, how do we do process improvement within the health system? How do we make our system better every day, better than it was the day before? We have a lot of different pieces of that, but one of the really cool things is our daily management system, which is a program that allows us to communicate information up and down from the front line all the way up to the C-suite and back down on a daily basis. It gives us the opportunity to know what's going on, what are the things that might impact our ability to take care of patients today. It also allows us to get information back down to the front line in how we're doing with our metrics as we're measuring our success. So at Northeast Georgia Health System, we have about 450 daily huddles. Those go from Tier 1 huddle all the way up to Tier 4. The Tier 1 huddles are really, in our area, are really the frontline people. Each of our programs has a Tier 1 huddle. Many of our areas like hospice or the library have their own Tier 1 huddles. Those then report up to a Tier 2 huddle, which is really a group of leaders that are across multiple areas. And then that reports to Tier 3 huddles, which are entities such as the Gainesville Hospital or all of medical education, where we have a Tier 3 huddle. And then each of the Tier 3 huddles reports to our Tier 4 huddle, which is the senior leaders for the health system, and allows all the way from our CFO and our CEO down to all of our vice presidents to be able to converse every day and talk about what are the things that will keep us from being able to accomplish our task of taking care of patients in that day.
So living in Gainesville, I feel like it has a great mix of really city life because Atlanta is very close. You're about 50 minutes to 60 minutes away. If you enjoy going to concerts, sports games, if you have a football team, you have a soccer team, you have a baseball team, so that's all very close by. But at the same time, you have nature very close by. The Appalachian Trail is very close if you're into hiking. You have Lake Lanier if you're into water sports. And I just think it's a really good mix of both worlds.
Hi, my name is Shannon Glover. I'm the Coordinator of Health Sciences Library and the Medical Library here at Northeast Georgia Health System, Gainesville campus. I am delighted to have you with us today. We have a wonderful, unique library system here at Northeast Georgia. We have the Fraser Resource Center, which is open to the community, as well as the Health Sciences Library, which is open for our staff members. The Fraser Resource Center was given to us through a lovely endowment to the hospital system, so you have access to 2 full-time medical librarians, as well as community access for your patients, their caregivers, and their loved ones. So you can really pretty much write a prescription for your patients or their caregivers to come into the library, the Fraser Resource Center, and sit down with a medical librarian and get credible health information. For your staff, we have the Health Sciences Library, which is open 24/7, so you can come in and out as much as you need and get with a medical librarian at any time.
Hi everyone, I'm Holly Stewart. I am the Director for Educational Support and Wellbeing here at Northeast Georgia Medical Center. Here at Northeast Georgia, we really try to take a holistic view and approach to resident wellness. We have a great educational curriculum where we are teaching topics that are relevant to you as trainees, and we try to give you tools and resources that you can put into play immediately just to stay well through your training. We also have a GME wellness coordinator, Jessica, who puts together fabulous social events for all of our residents and fellows. We really want to get you all out into the community, connecting with each other, really building those bonds and friendships that are going to sustain you throughout your time here. We also have a wonderful partnership with our internal employee assistance program, and through that we offer free and unlimited counseling to all of our residents and fellows, which is a great asset for you to have while you're doing your training here. And then finally, we really want to take the systems view to well-being. We have all these individual resources, which are fantastic, but we also want to go upstream and really look at the issues that are causing burnout or contributing to stress. And so our House Staff and Wellbeing Council is made up of residents and fellows from all of our programs. We're looking at these issues that are impacting residents and really trying to do some problem solving and make a difference, and to create a great and healthy training environment for all of you.